A very good afternoon. The NHS is calling on parents to vaccinate their children following the death of a child with measles in Liverpool. Alder Hospital says it can't comment on individual cases, but has said it has treated 17 cases of the disease since June. Health experts say the uptake of vaccinations in the UK has effectively stalled over the last decade. Well, let's speak to our North of England correspondent, Shingy Mayoriki, who is outside Alder Children's Hospital in Liverpool. And this is clearly very concerning, the death of one child and clearly a rise in cases, not just in Liverpool, but also in London and elsewhere too.
Yeah, that's right. Sky News understands and now can confirm that the child has died after contracting measles. They were being treated here at Alder Children's Hospital in Liverpool. We also understand that child also had other serious health complications. And like you were saying there, Darren, it folds into a bigger national picture in which vaccine hesitancy is on the increase, while the number of people receiving the MMR vaccine for measles, among other vaccines, is on the decrease. And if we just take a closer look at Liverpool, for example, where that decrease is perhaps sharpest, the MMR vaccine uptake rate for children by the age of 5 here is just 73%. That's significantly lower than the average across the Northwest, which is 86%, and the whole of England, which is 84%. And that's prompted Alder Hospital to put out that statement that you're referring to there, saying that they've treated 17 children since June for complications of the health issues related to measles. And they've also urged parents to protect their children by getting them vaccinated. And there is a broader discussion about vaccine hesitancy off the back of last year, where we saw similar spikes in Birmingham and London. And we've been speaking to experts at Sky News about this, including Helen Bedford, who I think we can take a listen to now. She's at the UCL Great Ormond Street Institute of Child Health.
This can be reversed, but we do need resource, and we really need to increase numbers of available health professionals and training of health professionals, and to make it easier for parents to get their children vaccinated in a range of places. If you can't get an answer to your questions from a health professional because they're not available, then you will look for it elsewhere and then maybe go to social media or the internet, where we know there is a lot of misinformation.
So she refers to two things there. First of all, that social media sphere, that disinformation. For example, we know that there are theories linking the MMR vaccine to autism that have been disproved, and also resource and putting more effort into vaccination drives. And speaking about Liverpool specifically, we know that public health bosses have sent out an open letter to parents urging them to get children vaccinated, saying that measles is spreading like wildfire in the community. And that involves pushes here, for example, at Alder Hospital, where they're now vaccinating children at A&E, and also we know that there'll be mobile vaccination centres operating throughout the summer. But I think the news of a death as well as a rise in cases here at this regional level will also prompt national concerns.
Yeah, indeed, Shingy, it is fascinating that in many regards, speaking to lots of public health officials this morning, they're saying, yes, disinformation is part of this narrative, but largely the lack of uptake, if you like, it is down to sometimes just practical things, like, for example, not being able to get to a clinic or have the time to do so, that parents aren't thinking about it quite as much as they may have done in the past.
Yeah, that's right. And I think that's where those mobile vaccination centres being rolled out across the Liverpool area come into their own. That's where they can get to people, particularly in the summer holidays outside of schools. They can get to people as they try and set in place their childcare arrangements, try and set in place their summer holidays. But you're right, it's a complicated picture that has seen vaccine uptake fall, and disinformation is part of that. But I think resourcing and being agile is also a massive part of how we combat this.
Really appreciate your time live there from Alder Children's Hospital in Liverpool.